Hello, I'm Dr. Bill Waggoner. Welcome to this week's Tuesday Tip. So I think that most of the listeners to these tips are very familiar with the Hall technique. But since I'm going to tell you about a recent article concerning the Hall technique, let me briefly describe it. The Hall technique is a rather novel approach to managing carious primary molars by cementing a stainless steel crown over the tooth without local anesthetic, caries removal, or tooth preparation. The notion is that sealing the carious lesion, particularly with a fluoride-releasing cement, will prevent continued growth of the caries. Of course, with no tooth preparation, the placement of the stainless steel crown will inevitably put the tooth into high occlusion and increase the vertical dimension of occlusion. That's what led to this study that I want to tell you about today. It was published in the November 2020 issue of the International Journal of Pediatric Dentistry by Nair and colleagues. The title was pretty long, but this is what it was. Digital occlusal analysis of vertical dimension and maximal intercuspal position after placement of stainless steel crowns using Hall technique in children. The goal of the study was to evaluate changes in overbite and bite force after placing crowns with the Hall technique. 20 children were recruited that had carious primary molars needing treatment, and they also had a class 1 occlusion. The mean age of the children was 7 years old. The teeth were restored with the Hall crown technique and no tooth preparation was done. The vertical dimension of occlusion and the bite force evaluation were done prior to treatment, immediately after the placement of the crown, and then 1 month later. The vertical dimension of occlusion was measured with a digital caliper and recorded as an overbite score in millimeters. The bite force evaluation was done with a T-Scan 3 device, which has a sensor that the child bites down on, which records the force of the bite. As might be expected, after placement of the Hall crown, the vertical dimension of occlusion increased significantly over baseline by a little bit more than 0.5 millimeter. Additionally, the bite force of the crown tooth was increased by 7 times the baseline value immediately post-operatively. However, the good news is, by 1 month, there was no significant difference to the vertical dimension of occlusion than it was at baseline. And the bite force recorded on the crown tooth was not significantly different at 1 month than it was from the pre-op measurement. Additionally, at 30 days, the occlusion was balanced and no child had complained of any TMJ issues. Now, the authors don't speculate on how the occlusion adjusted, but it has been previously hypothesized that the occlusal adjustment after Hall crown placement occurs by submergence of the crown tooth rather than over-eruption of the surrounding teeth. The fact that the overbite and the vertical dimension of occlusion did not change significantly from baseline to 1 month seems to reinforce the notion that it's the crowned tooth that probably does most of the adjusting. This study helps validate the use of the Hall crown technique as having only transitory changes in the occlusion, which seem to be well tolerated by children. Don't forget that NewSmile has a line of stainless steel crowns that work very well for the Hall technique. As always, thank you for listening, and I'll see you again next week on Tuesday's Tips.